A condition that causes sudden fainting due to drops in heart rate and blood pressure. Now have access to groundbreaking treatment here in the region. Joining us now is cardio electrophysiologist at MedStar Washington Hospital Center, Dr. Apostolos Tsimploulis. I hope I got that all right. A lot of syllables
You
here.
absolutely got it right. Thank you, Marina, for hosting me, and thank you for raising awareness of our community for health-related topics.
Yeah, what exactly is this? Because it seems as though fainting spells, and I think a lot of people can probably relate when they get their blood drawn, when they see something they can't handle, they just pass out.
You're exactly correct. You're spot on. So what's happening is that syncope, what is syncope? This is a transient loss of consciousness. The most common cause of syncope is what we call vasovagal syncope. So it's estimated approximately 1 out of 3 people will experience a vasovagal syncope in their lifetime. So, and this is very common in patients, especially between 10 and 30 years old. So what happens is the vagus nerve that carries signals from the brain to the heart, on some occasions it starts over-functioning. So in situations like stress, when you see a needle, overcrowded places, pain, and in combination with dehydration, then the vagus nerve overfunctions, overstimulates, slows the heart a lot, and there can be drop in blood pressure, and people may pass out. Usually people experience blurry vision, nausea, some prodromal symptoms like clammy hands, and then they eventually pass out. On most occasions, after detailed history and some exams by EKGs, like echocardiograms, and ruling out any significant other conditions, heart conditions, we make the diagnosis of vasovagal syncope. People respond most of the times very well on conservative measurements, like we recommend aggressive hydration, avoiding triggers, compression stockings, and on some occasions medications. But sometimes this vasovagal syncope can be very severe. People can have no heart rate for several seconds, and even no coordination between the upper chambers and the lower chambers of the heart. And then this is when you start the discussion about potentially placing a pacemaker. And imagine when we mainly have patients, young patients between 10 and 30 years old, when you have a conversation about placing a permanent pacemaker, it's not a pleasant discussion to have. So yeah, nowadays we have this new procedure, and we're the first medical system to offer this procedure in our region. So first of all, I want to underscore that this is not the standard of care yet, but very recently in our recent Heart and Rhythm conference in San Diego, there was a presentation of very promising results. A study showed that there is 78% decrease in episodes of vasovagal syncope and 97% decrease on the need of pacemaker. So yes, we offer this procedure here in Washington, D.C., and so far, the results are very promising.
What does this procedure entail?
So, yes. So I will tell you, we bring the patient here at the hospital one day. We deliver anesthesia. The patient is sleeping. And then we go from the groin and we put some catheter inside the heart. And by using cutting-edge technology, which is provided by MedStar Health, and some sophisticated methods, we identify the endings of the nerve. And we apply some heating energy, some burning energy. So we modify the effect of the vagus nerve in the heart. We decrease its effect. So this procedure lasts 1 to 2 hours. Then we take all the catheters out of the body. And then depending on how the procedure went, the patient can go home or even stay 1 day for observation.
You very clearly stated this is not the standard of care. Obviously, this would be, it seems as though, for extreme conditions for someone who's having multiple fainting spells, right? I mean, at what point would this be considered?
Correct. So this is not yet the standard of care because we don't have the data. I'm suspecting that down the road, in the next few years, well, more and more will perform this procedure more commonly than we have the data to support this in our guidelines. So usually we recommend this procedure in patients who have fainting spells, no heart disease that can cause fainting spells. We clearly see that this is effect due to vagus nerve from monitors like monitor rhythms like zyopathies, and we can see this effect of or other tests like head-up tilt test or some heart recording devices. Then this population which suffer from many episodes, and we're discussing about that the next step is placing a pacemaker, that's a very good alternative for someone having a pacemaker for many, many years.
Yeah, definitely. Incredible advancements in science. We appreciate you sharing it here on the DMV Zone.
Thank you so much for hosting me. Take care, Marina.